Universal healthcare, the thing that can help save the world. Today in the United States, the healthcare system is a mess. Healthcare is extremely expensive and it has left many people homeless trying to pay off medical bills. Since the beginning, healthcare has been a political struggle for our nation. Racism, sexism, finances, unfairness, and the differences in our government has caused our nation difficulties to achieve universal healthcare for all. We can make healthcare accessible if all of the people in our nation were to know the availability and the benefits about healthcare programs. Universal healthcare will benefit our lives now and transcend the lives in our children's future. As a human being, I know being supported and treated equally with healthcare brings me peace of mind. Universal healthcare will allow us to feel safe, have the support we need, and create a small opening for the brighter and better future we all deserve. First, we will talk about some of the problems we have with the healthcare here in America. Then we will discuss some of the causes for our nation's struggles in healthcare. And finally, we will look on ways to make healthcare accessible.
Because of the hardships that many of us may experience due to health problems that are most of the time inevitable, we are unable to receive the proper health care. This is resulting in many people finding themselves struggling financially. Many people suffer from illnesses and health issues that require doctor visits, medications, treatment, etc., and they are unable to afford the adequate health care to treat these issues. Because of this, you do have to pay the total cost of medical care that you will be needing, which could end up being a fortune for many of us, and we are unable to afford to pay these high costs. These issues have unfortunately been the result of people losing their jobs because they are unable to take off sick time from work to go to the hospital and treat their problems. It is resulting in housing problems, which then lead to poverty and homelessness. According to the National Healthcare for the Homeless Council in their fact sheet posted in February 2019, the loss of employment due to poor health becomes a vicious cycle, and without the funds for healthcare, one cannot heal to work again, and in these situations, available savings are quickly exhausted. The issues that arise from the high cost of healthcare and how inaccessible it is for some people makes this issue intertwined with homelessness. According to the National Coalition for the Homeless in an article posted in July 2009 for nationalhomeless.org, inadequate health insurance is itself a cause for homelessness. Many people who do not have health insurance do not have the income nor the resource to pay for health services on their own. The high cost of health insurance combined with the high numbers of people who are underinsured or uninsured means that people are risking the potential bankruptcy if they were to develop a serious illness. In turn, this causes people to have to make the choice between paying hospital bills or paying their rent to live in a home. Now that I have talked about the problem with the healthcare system and how this issue intertwines with homelessness and all of its issues that do lead to it, I will now move on to the causes of this issue.
There's many causes of healthcare that create homelessness. The main point that I will talk about is barriers to healthcare. These barriers are the reasons why healthcare is inaccessible to the homeless. Having these barriers can cause more health issues or lead to the worst case scenarios. There is a strong connection between homelessness and healthcare. According to the National Healthcare for Homeless Council, people who are homeless have higher rates of illnesses and die on an average of 12 years sooner than the general U.S. population. There are people who have gotten sick or injured and can no longer return to work. They tend to lose their jobs and no longer provide for their families and become homeless. These same people continue to have these health problems living on the streets with no medical care. Their injuries get infections which lead to more health problems. Illnesses are untreated and become severe and can lead to death. Most of the homeless people need medications for infections and pain. Many homeless suffer from mental illnesses and need psychological help. They're in pain and are suffering day to day to make it through. There is a big variety of health problems that cause many people to be homeless. According to the National Library of Medicine, as these diseases progress and lead to repeated and more serious bouts with opportunistic infections, the individual becomes unable to work and may be unable to afford paying rent. Many health problems bring lots of pain. They can no longer afford these pain medications and turn to alcohol or drugs to ease the pain away. Most of these illnesses or infections bring massive healthcare expenses. Most common health problems in homeless people, according to the National Library of Medicine, are traumatic disorders, skin and blood vessel disorders, respiratory illnesses, chronic illnesses, mental illnesses, and miscellaneous health problems. Due to these health problems, many people are out living in the streets in pain. Healthcare needs to be accessible to these people that are always in grave pain. Now that I have talked about the causes of homelessness linked to healthcare and what types of health issues connected to homelessness, I will now talk about the solutions for this issue.
Although there is no one solid solution or quick fix to make healthcare for the homeless more accessible or even free, it is clear that we can start by getting more exposure towards health programs and extending care in a preventative manner. Now, in order to make healthcare more accessible, there has to be exposure to health programs. According to the article Healthcare Services for Homeless People, published by the National Library of Medicine, services that are generally brought to the homeless rely on public funding due to how the problem has grown beyond a level that most private sectors can support. By creating more exposure towards health programs that specifically cater toward those who are unhoused, it allows more funding and aid. The Healthcare for the Homeless projects are considered to be an extremely effective network of healthcare services developed. Within these services lie different healthcare models, such as shelter-based clinics, rescue missions, non-sectarian programs, as well as public-private programs. Another way to make healthcare more accessible for those that are unhoused is to extend healthcare in a preventative manner. To further explain, instead of waiting for the homeless to seek care, we bring our care services to them. This is called outbanding care. Now, according to an article by Sachin H. James, Homelessness is a Healthcare Issue, Why Don't We Treat It as One, published by Forbes. It says that by outbanding care within street medicine teams, mobile medical clinics, community workers, and other outreach teams, they have effectively demonstrated that they can build trust and deep relationships with people experiencing homelessness and treat many of their needs without ever having to admit them to hospitals. Since people who are unhoused are twice as likely as housed people to have unmet medical care needs, it is extremely important to have a coordinated and specialty care. Coordinated care offers coordinated teams that are better care for those who are suffering from more complexities that may come from mental illness, substance abuse, and other underlying health issues. Specialty care is a care for those who are unhoused that have unique needs that Medicare or Medicaid cannot address, such as complex behavioral health services and transitional or recuperative care. Overall, although there is no simple or quick solution to make healthcare for the homeless more accessible or even free, by starting with more exposure to health programs and extending better care in a preventative manner, we are able to come closer to fixing this problem.
First, we talked about some of the problems we have here with healthcare in America. Then, we discussed some of the causes for our nation's struggles in healthcare. And finally, we saw what we can do to make healthcare more accessible. Universal healthcare will allow us to feel safe, have the support we need, and create a better future for everyone. Universal healthcare, the hero and friend we all need.